Hello, welcome to Spotlight on Guilford. I'm your host, David Weinberg, and we're talking today with Connecticut State Representative Sean Scanlon. Thanks for coming, Sean.
You're welcome. Good to see you again.
Yeah, you too. And so since the last time you visited us, you've been pretty busy.
I have been a little busy, yeah.
I think I counted 23 bills you've introduced.
Oh, I don't actually know what the final number is, but it's been a busy 2 years since we last had a good conversation.
And you're chairman now of the Real Estate and Insurance Committee?
Yep, Insurance and Real Estate Committee, and I became the chairman of that in January of this year. So I had a lot of learning to do of the insurance industry and real estate, and we had a very productive session. We passed 45 bills out of committee, and so far 17 have been signed by the governor and passed both chambers. So it's been an exciting year.
And which one is the best?
Well, the one that I probably worked the hardest on was a bill to regulate what are known as rideshare companies like Uber and Lyft.
Okay.
And that was something I had worked on when I first got elected in 2014. I love the service. I think it's an important platform that people, especially my age, love to use. But it had been completely unregulated in the state of Connecticut. And so we thought that, for public safety and consumer protection, we should have some sort of common sense things like background checks for drivers or insurance standards for the drivers. God forbid you get an accident when you're in an Uber. What happens if the driver wasn't, covered up to snuff? Vehicle inspections to make sure that you're getting in a safe vehicle. So that was something that passed on a bipartisan basis in both the House, the Senate, and the governor signed it actually 2 days ago. So became law, and I think to date that's the biggest bill I've worked on.
So we'll see what the impact is. We'll see if those ratings go up or down.
We'll see. But I feel like you won't notice the difference in your service, but just behind the scenes, there'll be a lot more going in to make sure that you have a safe and smooth ride whenever you get into an Uber.
Okay, well, speaking to the governor is kind of unhappy with the House of Representatives right now. What's that all about?
So, we've had a very difficult year when it came to the state budget and balancing the state budget this year. Our session ended on June 7th, and we unfortunately were not able to come up with a budget by the time that we adjourned for the end of the year. That's happened recently 3 times. It happened in 2009, 2003, and 1991, famously when Governor Weicker and the legislature were butting heads over the income tax. So this is not uncharted territory, but it is unfortunate territory. I wish that we could have come up with a budget by the time we left. We didn't, and tomorrow, on June 30th, the budget will actually, the new fiscal year begins. So we're going to begin the new fiscal year without a budget. And our intention as of today actually was to come back on July 18th and pass a budget. That's what we as the House Democrats have sponsored to do. I hope that our friends on the other side of the aisle will join us in that and we can pass a bipartisan budget to show the people of Connecticut that we're in this together. We have a pretty substantial deficit right now. It's $5 billion over the course of 2 years. And if we can sort of come together and balance that, I think it would send a very strong signal to the people of Connecticut.
So let me ask you, talking about people on the other side of the aisle, so the landscape has changed considerably since the last time we talked. How does that affect you in the state legislature?
Well, I have always sort of tried to be a very bipartisan guy, and this goes back to my very first campaign in 2014. I knocked on a door in downtown Guilford on Summer Street, and the couple invited me in, and they said, you seem like a good guy, but we want you to do something for us. And I said, sure, sir, what can I do? And he said, I want you to try to have lunch with a Republican when you're at the Capitol. And I sort of laughed, and he said, no, I'm serious. I think that if you can sort of break bread and get to know somebody on the other side of the aisle, maybe you can find a way to work with each other. And so I did take that gentleman's suggestion, and 2 years later, when I knocked on his door again last year in 2016, he said, have you been having lunch with the Republicans? And I said, yes, I certainly have. But in all practical sense, just take my committee, for example. I'm the chair, as you mentioned, of the Insurance and Real Estate Committee. In the past years, when the Senate and the House have had one majority party, there's one Senate chair and there's one House chair of each committee. Well, this year, the state Senate is actually tied 18-18 for the first time since 1892.
Wow.
And the Senate, and the House, where I am, is a 79 Democrat, 72 Republican majority. So this year we had 3 chairs to every committee. There was 1 Senate Republican, 1 Senate Democrat, and 1 House Democrat, which was me. When you have 3 people trying to make decisions, it can be a little difficult, but we found ways to work together. I have a great relationship with Kevin Kelly, who's the Republican state senator that I chair the committee with. And like I said, we passed 45 bills out of committee this year. I would say, probably 43 of them were all bipartisan, unanimous votes, because we really had to work behind the scenes to get consensus. When you have tight margins in the legislature, you have to get consensus, and I think that's the best case scenario for the voters, right? Because when I see people at Big Y or on the street, they say to me, geez, I can't believe you like politics, because it would drive me crazy. And all the fighting that you have, and I turn on the news and all you guys are doing is yelling at each other and nothing's getting done, whether it's in Hartford or Washington. And so I tell people, look, hey, in Hartford this year we had to get things done because there was no chance that we could have just said, hey, you do what you want, I do what I want, no bill would pass.
So what's the difference between Hartford? Why does Hartford work and Washington evidently not?
It works, I think, for 2 reasons. Number one, the biggest one is money. If you're a congressman or a congresswoman, all you do all day long is sit in a room by yourself and call people for money. And you have to raise millions and millions of dollars every single year just to run for election every 2 years. In Connecticut, we don't have a system like that. I have to raise money to run for election every year, every 2 years. And it's a very easy process where I raise money for state rep. From 150 people, I get $5,000, no donation more than $100, and the state then gives me money to run a campaign. My opponent is on the same playing field. So in theory, we can raise our money at the beginning of the campaign and then focus on knocking on doors and talking about the issues. Whereas if you're in Congress, all you do is raise money. And the easiest way to raise money, David, is by bashing the other side. So that's why you'll see Democrats sending out emails right now saying all things negative about President Trump. And then you'll see Republicans saying all negative things about Nancy Pelosi or Bernie Sanders and all this stuff, and they're raising massive amounts of money like that. We don't have to worry about that in Connecticut. So that's point number one, is we take money out of the equation. Point number two is that it's easier to get to know somebody when you're seeing them every single day, and it's a smaller branch. In Guilford alone, I have a Republican first selectman, Joe Mazza, that I talk to probably 4 or 5 times a week. North Guilford is represented by a different state rep, Vinnie Candelora. He's a Republican. We're talking constantly about what we can do on behalf of the town. So we sort of are forced to work more closely together at the state level and the local level than they are in Washington, because all they're doing is basically going down there for a few days a week, raising money, and spending no time talking to the other side, which I think is unfortunate.
So there's money.
Yep.
And we hear endlessly about the role of the media in creating the echo chamber. And
Yeah.
then, so do you think that you mentioned Big Y earlier.
Yeah.
Does the grocery store factor have something to do with it?
Yeah, I mean, it does. I mean, you bring up a good point of media, which is that, these days it's very hard for us to even agree on the basic facts of an issue. Because, one side gets the news from Fox, one side gets the news from MSNBC, and neither of those sources are admittedly the most non-biased in the world. And so I think we have trouble as policymakers when we try to attack a problem. If we can't even agree on the central premise of the issue, it's tough for us to find solutions. So I think media does play a role in it. But yeah, when I go to the grocery store, and I'm trying to get my groceries for the week, I try to go on Saturday or Sunday, and sometimes I go with my fiance, sometimes I go alone. People will stop me and they'll come up to me and they will not be shy about saying what's on their mind. But I embrace that because that's essentially like the office hours that I do every single week.
Yeah, we get a lot of feedback even for GCTV there in the grocery.
I'm sure you do.
So, well, let me ask you this: what do you think the answer is on a national level? It sounds like and it looks like people are able to. No matter how dire the situation, people in Hartford are still able to talk to one another and get along. You talked about some of the reasons for the animosity, but how do you fix it?
I think you fix it by being courageous and being okay to compromise. Part of the reason why I think a lot doesn't get done in Washington, and frankly a little bit more in Hartford, is because people worry about primaries. They worry about ideological purity, in the sense that if you're not with the party on 99.9% of the issues, then you're in some way an unpure or a fake or a lesser Democrat or Republican. If you're compromising, back in the day, even as early as 10 or 15 years ago, you were seeing major pieces of legislation pass, whether it was in Washington or in Hartford, with complete bipartisan support. And that was because I think people got elected and they rolled up their sleeves when they got up there and said, look, you believe in a set of ideals that really sort of drive your ideology and the way you look at issues. But I have a completely different set of issues, and it's our job to sit in chairs like this one and maybe over a cup of coffee or lunch or dinner or whatever, find some common ground. That becomes a little bit harder in the 24/7 political melee that we live in, where one vote is put up on Twitter and tweeted 1,000 times, and it's harder for us to find that common ground.
And there's less room to change your mind.
Yeah, there is less room to change your mind. And I mean, there's been things in my short political career, I've only been at this for 3 years, where I have changed my mind on an issue. It's very hard to do that because then there's screenshots of you saying in a press release that you feel this way, or me saying on Twitter or Facebook that I support this and now I don't. But we have to be okay with that. I mean, people change their minds every day in their personal life. We're all just people at the end of the day.
And no one puts up a tape and says, but Sean, in 2014 you said this, let's watch.
Yeah, that's exactly right. And if you don't do that in your house, there's a lot of things I've probably said to my fiance, and then a couple months later I sort of backtrack a little bit, and she doesn't go to the tape and say, hey, I caught you red-handed. It's okay to change your mind.
That's why you don't want one of those Alexis kind of devices in your house. You don't know what it's listening to.
You don't know, yeah.
So let's talk about these 24 bills that you introduced. Now, of those, what's passed?
Well, since I got elected, I've spent a lot of time on the issue of opioids. Opioids is something that I didn't really know a lot about when I first got elected in 2014. And then shortly after I got elected, I had a series of meetings with some parents in Guilford who had lost children to this epidemic. And I got assigned to the Public Health Committee. I realized that nobody was really working on this issue back in 2014 in that committee. And I set out to learn everything I possibly could about this issue. I went on ride-alongs with the narcotics division of the Hartford Police in the middle of the night raiding houses. I spent time at emergency rooms, meet with doctors, parents, providers, just learned as much as I could. And in each of the 3 years that I've been in office, we have passed what I believe to be a significant piece of legislation. 2015, I sort of co-sponsored it, wasn't really that involved. I was still getting my feet wet. 2016, I helped write the bill that made Connecticut the second state in the nation to limit the number of prescription pills that a person could get for an acute illness, meaning like if you got your wisdom teeth out or you stubbed your toe and had to get some pain relief, with very clear exemptions for chronic pain. And this year we made further strides to limit that down to 5 days for children. Young people especially have been dramatically hit by this crisis. We put it to 5 days. And I think that, David, there's no silver bullet solution to this problem, but every year that I'm able to have this honor of being a state rep, I want to keep working on this issue.
So the idea behind that is to tighten up the supply.
Yep.
So that people aren't getting them out of their own medicine cabinets?
Yeah, so the scary fact of this is that from the 90s into the 2000s, there was this dramatic surge in the number of prescription pain pills that were introduced into our society, whether it's Oxycontin, Vicodin. Pain became the fifth vital sign, as the doctors will talk about. Because of that, there's such an oversupply that's out there in our society that 4 in 5 people who start using heroin start with prescription drugs. And 50% of those who start get it from a family member or a loved one who has them in their medicine cabinet, because we used to have this model where if you got your wisdom teeth out, you would get sent home with 75 pills, and you may only use 3 or 4 of them, and then you put them in your medicine cabinet. Well, that dramatic surplus and excess is causing a lot of people to get hooked on these very powerful drugs. Problem, David, is when they run out of those pills, when that bottle is gone from their medicine cabinet, they need that high because they are now addicted to it. Those pills, each of them probably cost you on the street right here in Guilford about $20, but heroin you can get for $5 a bag, and you get a very similar high. So that's what leads people to heroin, and heroin is very deadly most of the time, because when you buy it, you don't know what's in it. You're buying it on the street, and it's very dangerous. So we felt very strongly, and the experts told us, that if we could cut off this mass oversupply, we could start to whittle down the number of people who are getting addicted in the first place, and then just stop the bleeding by treating those who are addicted right now.
So that seems like a common sense place to start, and we don't really know whether it's working yet or not, or do we?
Well, the law that limited the prescriptions for the first time, again, we were only the second state in the country to do that behind Massachusetts, started in October of last year. So we've only, sort of hit the 6-month mark, 8-month mark, I guess you could say. We don't have any data yet. I hope we'll have some at the year mark that we'll be able to sort of see the number has gone down. When that happens, I hope that we'll see a correlating drop in the number of overdoses. Last year we had 917 across the state. More people will die, David, this year from that than they will from car accidents and gun violence combined. And the average, the highest cause of death for anybody under the age of 55 is from opioids. So big problem.
So do you have a sense of what's driving? So on the one hand, they're available.
Yep.
That's what you're saying. And so maybe the most effective approach is to do what you've done, and that is to cut off the supply.
Right.
But do you have any sense of what's driving people to take them in the first place?
Well, I think...
and it's young people we're especially concerned.
Young people especially. I'd say 2 things. Number one is, the feeling that you get if you're in pain, whether that's emotional pain, physical pain, from taking an opioid, you immediately feel better. They're meant to take away pain. And in the years since we've had this economic downturn, a lot of people are in a lot of pain. And so when you look at what's been hardest hit by opioids, it's places like West Virginia is the #1 state in the country right now. New Hampshire is close second. We're top 5 in Connecticut, which is hard to believe. But when you look at some of the most economically depressed areas, you'll see the highest incidence of overdoses from this drug. And I think there's definitely a correlation there between the economy and drug abuse.
So people are dulling the pain or putting off the pain or just trying to get away from a really unpleasant situation.
Absolutely. Absolutely. And we have an obligation, I believe, to try to help those people out because recovery is possible. It's something I hear all the time when I'm talking to people who have recovered. We just need to figure out what it is that's going to be to get that person treatment. There's a lot of different treatment mechanisms. There's no one size fits all to get somebody better. But
now you've proposed a recovery high school.
Well, I did propose a bill this year on a recovery high school. Massachusetts does have that, and basically, there are kids that get kicked out of schools in towns, frankly, like Guilford, where maybe a little more affluent of a community, and the kid gets kicked out, and the main driver could be that they have a substance use disorder where they're using drugs. I think the best way for that kid to try to recover is to go to a place with peers that are dealing with the same problems and teachers and staff who are equipped to help somebody with that and actually get them the treatment that they deserve, rather than just saying, hey, we're going to give up on this kid. We're going to expel them because they got caught maybe with drugs in a school. We don't want them necessarily in the same environment as everybody else, but we also don't want to say, hey, just go home and get homeschooled, because that's not going to get them any better. So it's an expensive thing to do, and obviously, given the budget crunch that we have this year, wasn't the year to do it. But I hope that in future years we can sort of keep that conversation going.
So, of the other bills that you've proposed that have been passed, what are you feeling good about?
Well, on the insurance committee specifically, I spent a lot of time on that this year. When you chair a committee, you're really in charge of all the bills that come into it. This year we had about 150 bills introduced by both Democrats and Republicans that came into my committee. We ended up sort of hearing about 75 of them in past public hearings. And then, like I said, we passed about 45. So my job is really just reading all of these bills, getting to know all these bills, and then deciding with my co-chairs what the ones that are going to move forward on. The insurance committee is an interesting one because, number one, Connecticut is the insurance capital of the world. Most of the major insurers, whether it's on the property and casualty side or health, are headquartered in our state. So you have a big industry presence here. There's 60,000 people who get to go to work every day in Hartford, and we got to make sure we protect our industry. But at the same time, we also need to protect consumers, and that's a little challenging because sometimes the bills that come through are very black and white. They're either for the industry to help the industry, or they're for the consumer, and we sort of have to cut through and see if there's any gray area there. So I spent a lot of time this year working on health insurance issues. Obviously, with what's going on down in Washington, people are very concerned about what might happen to their health insurance. And then things like, I'll give you an example. Connecticut was one of only 2 states in the entire country, with New Mexico and Connecticut, that didn't allow you to have your insurance for your car on your app of your phone. So a lot of people get that insurance card mailed to them, gets lost in the mail of everything, but they have the Geico app. They get stopped in a traffic stop, or they get into a car accident. A lot of people naturally want to show the police officer the app that says, "Hey, I'm Sean Scanlon, I have insurance," but that was illegal in Connecticut, and so I worked with the police officers association, the police chiefs union, to get a compromise on that, and we became, I guess, the 49th state to pass that law. So we're always just looking for ways that we can make it better for the consumer.
So what will happen if there's a big cutback in the Medicaid expansion?
Yep.
What happens here in Connecticut?
So under the Affordable Care Act, which is commonly known as Obamacare, we've had about 200,000 people qualify for Medicaid expansion. What does that mean, David? That means that Medicaid exists primarily for people who are of low income, pregnant women, people who are disabled and need help paying for their insurance. That's who's usually on Medicaid. But under Obamacare, what we said was, look, there's a segment of our population, primarily people who are middle class, who are not poor enough, for lack of a better word, to qualify for Medicaid, but they're not making enough money to buy insurance on their own. And so a lot of times they go without insurance. And when people go without insurance, it ends up costing us as a society way more money in the long run. So we expanded Medicaid. 200,000 people in our state have been expanded and now have insurance because of that. And another 100,000 joined what's called the exchange, which was a private marketplace where people could buy into it, and they could buy private insurance at a discounted rate through the exchange. So 300,000 people are on what's called Obamacare in the state, in a state of 3 million people. So it's not an insignificant population. I don't know what's going to happen in Washington, David. I couldn't tell you. It changes from day to day. I think we should be trying to fix Obamacare and not necessarily repealing it. But if we do repeal it in Washington, there's 300,000 people who are going to be wondering what they're going to do for their health care. And as the insurance chairman, I'm going to have to play a role. And I'm already working as part of a working group with our insurance industry to figure out what it is that we can maybe do to help those folks out.
Any good ideas yet?
Well, I think part of the problem is that people are frustrated right now. They're seeing that their premiums are going up, their deductibles are going up. That's not necessarily, in my opinion, the fault of Obamacare. That's the fault of the way the insurance industry is changing. Most people used to get insurance through their employer, but now employers are paying less and less to contribute to your insurance if they're giving you insurance at all. That's why you're seeing the rise in high deductible plans, because the insurance company is saying, I need X amount to care for you. And the employer used to say, well, I'll cover 80, you cover 20. That ratio is dwindling. And so people are frustrated, and they look at what's happening in Washington and they say, again, why can't you guys just figure out a way that my premiums can be lowered, but you don't get rid of the things that make sense, like pre-existing conditions. You shouldn't be banned from getting health care just because you have a pre-existing condition. Women's health care, if there are cancer screenings or contraception, things like that, that under the Affordable Care Act are covered that might not be under this bill down there in Washington. They're just saying, hey guys, can you figure this out? And I think we have an obligation to do that.
So Aetna announced today that they're moving their headquarters to New York City.
Yep.
And they said they're going to wait and see on the majority of their employees who are here. And that's after 250 years of being headquartered in Hartford.
Yep.
So you're kind of in the crosshairs on that.
I am, and the announcement today that they're going to move their headquarters is definitely sad, and unfortunately it was expected. I had been talking to them, and they had sort of giving me word on this. But it's important for your viewers to know that main campus that you drive by when you go on 84 with the big sign, the big building, that's not going anywhere. There's still going to be 5,000 to 6,000 employees based in Connecticut here. When they say headquarters, what they mean is the CEO and his office. About 100 people are moving to New York. So I don't say that with a shrug and just say, whatever. I think we have to look at why they're saying they left. And it's the same thing with GE 2 years ago when GE left. They're not moving to states that have lower taxes than we do. They're not moving to states with less regulation than they do. They're moving to states that have better climates than we do. There's just a lot more happening in New York City and Boston. And so those who say, Connecticut's in a bad for business, there are certain arguments that they're making that I would give you and say, hey, that's accurate. But you can't say that these companies are leaving because of tax or regulation, because they're going to states with higher taxes than we are. But they're going because there's more to offer. And that's what I'm primarily concerned with, David, because I think we have to get Connecticut's economy moving in the right direction again. And I think we have to start by figuring out what it is that we can do to grow our economy so that the GEs and the Aetnas or the mom and pop business that's saying, hey, we want to have some confidence that we can invest in this business in Connecticut and grow it and start hiring more people. That's not an overnight thing, but I think it's something that we should be focused on 110%.
So now I see you've been doing different things to reach out to your constituents. Now, we know you go to Big Y. That's one way.
Yeah.
What else have you been doing?
Well, I hold what I call coffee and conversation office hours. I do them about every month and a half, 2 months, especially when session is happening. It's harder for me to do it because my schedule is a little more unpredictable. But I basically will go to Dunkin' Donuts or the library. I will literally bring a box of Joe and a couple cups, and I basically sit and just say, hey, what's on your mind? And usually I get lately about 30 or 40 people to show up, and I have everybody sit in a circle and we just have a conversation like we're having here. And people come there and they have some things to say to me that they agree with, some things that they don't agree with, and we basically just talk about what we can do. Last month I held what I call the Citizens Budget Workshop, which was something I was honestly a little nervous how it was going to go. And I basically told my staff in Hartford, look, I want to take the 20 best Democrat ideas we have to balance the budget and the 20 best Republican ideas. I want to put them on flashcards, and I want to give them to a group of people who are complete strangers and have them sit around a table together for an hour and try to balance the budget. I had about 100 people show up, 10 different groups, and 9 of the 10 balanced the budget in an hour.
Wow.
And so when people ask me what I learned from that, I learned something pretty simple, which is that if these people can do it in an hour, why is it that we cannot do it in Hartford in 6 months or a month? And the answer to that is that they were willing to roll up their sleeves and compromise. It wasn't just a bunch of Democrats sitting at one table and Republicans sitting at other. It was people from mixed ideologies that at the end of the day could figure out you got to give a little to get things done. And I hope that's the lesson that my colleagues in Hartford learned.
But the barriers to that are what we were talking about.
Sure. Yep.
Earlier.
But to me, when I do things like that in my district and show people sort of outside the box ideas, or that I'm willing to think outside the box, I think that they look at that and say, hey, that's good. And I think more of my colleagues should do some things like that that are a little outside the box, because I think when you do that, people reward you. People are so sick and tired of politics as usual, and they're so sick and tired of politicians as usual sort of saying like the most poll-tested thing or what they think is going to be the most broad appeal to most people. That's why I think you look at our political system right now and you have some pretty non-traditional people having some success in politics because people are so sick of a system that they don't feel like has worked for them. So rather than having a town hall meeting where I stand up in the front and I lecture people on what I think is going on with the budget, I said, let's flip that around. Let's have them lecture at me and have me stand up in the front of the room and then tell me what it is that they decided to do. And it worked out. I learned a lot about what they were looking for with this budget, and I think about it every day.
So you're taking the lessons from that exercise into the...
Absolutely. And I've always felt that there's nothing a politician can do that's more important than listening. A lot of people, I think, go into politics and they say they're going to listen to people, and they tell people what they want to hear, and then the more they're up there, they forget about what they've heard. And that's why I do these chronic office hours, I think probably more than any other elected official in our area, just because I truly value what I learn at those meetings. And I did one last week, and there were some ideas that we talked about that are not traditional Democratic ideas, but they're good ideas, and I'm not afraid to admit they're good ideas. And that's what we have to have more of in Hartford, Washington, wherever we're in government.
So, we got our coaching earlier. Your camera's right over there. Yeah. What is it that you'd like to say to people of Guilford and anybody else who sees this that you haven't said and that you may not get a chance to say?
I say what I always say, which is that my door is constantly open to anybody who lives in our community who wants to share an opinion, a thought, frankly, an idea about what they'd like to see happening with their government in Hartford. And also, if they're having trouble with something, a lot of my job is not just passing bills and legislating. A lot of it is dealing with people who are having trouble with state agencies. So, whether it's a problem getting a license test at the DMV for your 16-year-old, whether it's if you have a problem with your health insurance, whether you have an issue with the way the state parks are being run, I ask people to reach out to me. My office is very accessible. My email is online. I give out my number pretty widely, and I live right here in Guilford, and you maybe even see me in Big Y. Don't ever be afraid to come up and tap me on the shoulder and say, hey, Sean, I know you're wearing a Yankees cap and a pair of shorts, but I have an opinion about something. That's my job. I love this job. I love serving my hometown of Guilford, and I hope that you'll always feel free to reach out to me anytime.
And it is easy to find your email online, but why don't you go ahead and...
It's very easy. It's Sean, SEAN .Scanlon, SCANLON, at CGA, C Charlie Gamma Alpha .ct.gov. And my phone number at the office in Hartford is 860-240-8585.
Well, Sean, thanks for coming. You've got to come back sooner.
I will.
This time, and we need to have some conversations with some other elected officials on how to maintain the civility that you and others are trying to promote.
Well, next time we'll get Vinnie Candelora, my friend and colleague from North Guilford, who is the deputy Republican leader, and the three of us can have a good conversation about that.
Yeah, let's do that. That would be great.
Yeah.
All right, Sean, thanks a
David.
lot.
Good seeing you.
You too.